Now that the neonates are stabilized, our focus shifts back to the mother. Recovery here is a dual challenge. She needs to heal from major abdominal surgery while immediately meeting the metabolic demands of lactation. Pain control is not optional. Pain inhibits oxytocin release, which disrupts milk letdown and maternal bonding. However, we have to be mindful of drug transfer through milk. Opioids like buprenorphine or methadone are the cornerstone here. They are effective and generally safe for nursing neonates. NSAIDs are incredibly useful for inflammation, but should be used with caution. Ensure the dam is hemodynamically stable and hydrated before the first dose to protect renal perfusion. This is also why those local blocks we did in surgery are so valuable. They reduce the need for systemic drugs in those critical first few hours. In the recovery ward, we are monitoring the standard vitals, temperature, heart rate, and respiratory rate, but we are also watching her maternal behavior. Is she accepting the neonates, or is she aggressive or indifferent due to pain or stress? We also need to monitor lochia. This is the normal postpartum vaginal discharge. It should be reddish-brown or green-black initially, but non-odorous. If it becomes fetid or purulent, we have a problem. Before discharge and in your client education, you must warn about the big three complications. Metritis, an infection of the uterus, usually presenting with fever, lethargy, and foul-smelling discharge. Mastitis, look for hot, painful, firm mammary glands. Hypocalcemia or eclampsia, this is life-threatening. It often starts with subtle signs like facial rubbing or stiffness and progresses to muscle tremors and seizures. This is most common in small breed dogs with large litters. Finally, keep an eye on the incision site. Puppies have sharp claws, and they will be kneading right next to that fresh surgical wound. Clients need to check daily for redness, swelling, or dehiscence.